would check the doctor's orders, make sure I have all of my supplies ready before I go into the room, and then I would go into the room, knock, hand hygiene, provide patient privacy, introduce myself to the patient. So hello, Mr. Smith, I'm Raylan. I'm going to be your student nurse for today. Can you please give me your name and date of birth? Thank you very much. So today I'm going to explain the procedure to my patient. So today we're going to be doing some tracheostomy suctioning. You sound a little gunky, but before we do that, I'm going to go ahead and check your lung sounds, okay? And I'm going to put a succometer on my patient's finger and monitor that, and then I'm going to leave that on throughout the procedure, and then I'm going to check his lung sounds. And every time I place this on your chest, just give me a deep breath, okay? And I would go ahead and do that on my patient's back as well. I'm going to go ahead and put my stethoscope in my pocket so it's out of the way. And then I'm going to go ahead and hyperoxygenate my patient to about 10 liters and make sure I monitor that pulse ox to make sure it goes up to 100 before I take it off of my patient. And then I'm going to go ahead and just get my tubing ready for my suctioning. Kind of make sure it's all connected, and then I would turn it up to about 80, between 80 and 120, but for this sake I would probably just turn it up to 100, and then I would check the suctioning later on in the procedure. So I'm going to go ahead and put on some clean gloves. And I'm going to make sure that my patient's taking some deep breaths in between, just to make sure that they're getting that oxygen in them while I get all my supplies ready. So this is going to be in the kit, and it's considered sterile water. So I'm going to open my kit up. So I'm going to just open this. And then I'm going to grab this, and I'm going to just toss this in my trash, and I'm going to move this over just a little bit so I have some room, and I'm going to make sure I just maintain the 1-inch border. And then before I continue to open it, I'm going to go ahead and open this up before I put on my sterile gloves, but I'm going to make sure that I don't touch the inside of this, just so that way it remains sterile. And with my clean gloves, I'm going to go ahead and pour my sterile normal saline into the basin, and making sure I don't break sterile filled on that part. And I'm going to just set this aside for now because I don't need it. And then I'm going to take off my clean gloves, toss them in the trash, and then I'm also going to put on a mask and then eye protection for the eyes. And then I'm going to go ahead and finish opening up. And I can touch the 1-inch border, so I'm doing so. I'm just kind of flipping it up. Flipping it up. There we go. Okay, so now I'm going to put on my sterile gloves. Okay, and then I'm going to go ahead and go inside the cup, making sure I don't touch the outside of it. And putting on the glove. That one was a little backwards, so I'm going to work with it. Okay, and right now I'm sterile, so I can touch this area. And I already set up my suctioning and whatnot, so that's all set up. So all I do, I'm going to just kind of position my suctioning tube to where okay. have this, and so now that I have this ready, I'm gonna kind of put a little bend to this so that way I can put this in my patient and it's not gonna, and then I'm going to go ahead and lose one of my hands. So I'm gonna lose this non-dominant hand, and I'm gonna just put this in. Okay, and I'm gonna test my suctioning first before I perform the procedure on my patient. So I'm just gonna go in the saline and just make sure it works, and it does. So I'm gonna go ahead and make sure my patient's oxygen level is to 100% or what the doctor ordered. And so I'm gonna go ahead and with my non-sterile hand take the oxygen off. All right, Mr. Smith, we're gonna go ahead and perform the suctioning. So I'm gonna go straight in until I hear a cough, 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 and then I'm gonna swirl and suction, suction, suction with my non-dominant hand as I'm swirling. And then I'm gonna take this out, and I'm gonna give my patient about 20 to 30 seconds in between passes, so that way he can kind of catch his breath and get his composure. And then I'm gonna go ahead and suction this out and kind of prime the tubing from all that mucus and yucky stuff. And then I'm gonna go back in and do another pass. So I'm gonna take this off of my patient, and then I'm going to go ahead and go straight in to hear a cough, and I'm going to suction and twirl, and then out, put this back on my patient, and then I'm going to prime it again. Usually it's about 2 to 3 passes. I'll probably just go ahead and do another one just to show. So I'm going to take this off my patient and do one more pass, and then here cough, suction, 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 all the way out, put this back on my patient, and prime the tubing again. I would then, since I'm done with this procedure, I'm gonna go ahead and just ball this up, put this in my glove, and then go ahead and take my other glove off. And I'm gonna go ahead and toss all this, and then I'm gonna look at my patient's oxygen level and then turn it down to what his prescribed order is. So just depending, I'll turn it down, and then I'm gonna go ahead and assess my patient's lung sounds one more time. So Mr. Smith, we're gonna just assess your lung sounds real quick, okay? And every time my stethoscope touches your chest, just give me a deep breath, okay?
I'm not sterile anymore. I'll take these off, and then I would reassess lung sounds. These sound way better.
Okay, Mr. Smith, your lungs sound a lot better now. So now I'm going to take off the pulse oximeter off of my patient because I've monitored it, it looks good. And then I'm going to make sure he's comfortable. I'm going to make sure both side rails are up. I'm going to make sure the bed is all the way down, closest to the floor, just for safety. And I'm going to make sure Mr. Smith is comfortable, ask him if he needs anything. And then after that, I would go ahead and leave the room, and I would also, before I left the room though, I would have gave him his call light, which there isn't one here, but we'll just pretend for now. And then after that, I would document when I left the room, and I would have performed hand hygiene, of course, when I left the room, and I would have documented how well my patient tolerated it, the oxygen levels, the secretions, and what they looked like. And that is it. Thank you.